if you're playing basketball or tennis or soccer long enough, at some point you tear your Achilles or you know someone who just did. Our Achilles rupture rate, say on the rise, or are we just noticing them more? Are they getting more press?
Rogue. Unity Physical Therapy.
And Safar, the smartest man in the room. Tim Charlton, the other guy. I am your host, Timothy Charlton. We're here talking with Beyond the Tear podcast on the Rogue Orthopedic Podcast Network, inaugural talk. All things Achilles. And we're going to start with an introduction to the smartest man in the room, Shayan Safar. So thanks for being part of the inaugural podcast, being the inspiration, really.
Thank you for having me and for organizing this.
Oh, my pleasure. One of many. For the folks who are listening who don't know you personally, let's start out with, how did you get into physical therapy? You're a doctor of physical therapy, but you have a wonderful history. You used to be a professional breakdancer for LL Cool J, correct?
Yes, this is true.
And he was a professional stuntman. So he's a man of many hats. But when did you get into physical therapy? Tell me your physical therapy journey.
So growing up, I always knew I wanted to do something in medicine. Grew up in Los Angeles. Yeah, I had Iranian immigrant parents, and they definitely were very high on doctor, lawyer, engineer. And I always gravitated towards medicine and becoming a doctor. So actually, I was always thinking about being an orthopedic surgeon growing up. And then in 2009, I fractured my radius ulna doing a wall flip off a garage. This is before I really learned how to do all these kind of crazy things. So obviously I had a plates and screws to fix it. And then that's when I got introduced to physical therapy. And I really just appreciate how much time the physical therapist got to spend with me just from the nature of the job, and then sort of opened my eye to that. And then I was always debating between physical therapy or medical school. Then I went on to being a professional dancer after I rehabbed that, did breakdancing, then transitioned to being a stuntman. I really
from breakdancing.
Yeah, because you're really good at picking up choreography. I did martial arts growing up. I did Taekwondo, and then learned acrobatic martial arts. And then I found out that stunt people make a good amount of money, and you can make a living off of it. And then so I did that for a while, but there was always a calling to kind of get back into something that directly helps people. So then I was like, okay, was still in school, graduated from UCLA, and then I was deciding what to do for grad school. And ultimately, just after a lot of reflection, I said, okay, I think physical therapy is sort of the path for me. And then still continue to do stunts even to today. Right before the injury, I finished on a big movie coming out next year.
Which is, can you name?
I can, because I'm in the trailer, Odyssey.
Oh, well.
Yeah. So I'm excited.
That's exciting. Well, when we have our future podcast, we'll be talking about the big release.
Yeah.
And then for the folks at home who don't already know, let's just do a plug for Unity Physical Therapy, our one and only sponsor of the Beyond the Tear podcast.
Yeah. And so after graduate school, I opted in for an orthopedic residency, which I think a lot of people don't know this, but obviously to be an MD, you have to do residency. But for physical therapy, the stats are like somewhere between 3 to 10% of physical therapists do residencies. And then there's orthopedics, cardiopulmonary, neuro, peds. And so I was like, if I'm going to do this, I want to do it right. So I did an ortho residency, became an orthopedic specialist. And then now I have a cash pay practice because really wanted to focus on one-on-one care with patients.
And that's where Unity Physical Therapy, if you're not going on right now to the internet, it's a fantastic, and actually he is one go-to for Achilles Tendon Rupture, which is really the inspiration of the whole podcast. I'm like, I when I come in, and sort of segue to how we met.
Yeah. So actually right after I finished that film, I was training one day and was practicing a move called Webster's, which I already knew in grad school was very high risk to my Achilles, which we'll get into why. I tore it. And then one of my cousin's friend was a fellow and recommended you. And then I think you had an opening the next day, and then surgery the next day, and then was lucky enough to get the surgery from you.
Kind.
History has written itself since then.
So the segue for the folks at home. So amazing, just sort of talking to a colleague from the day one. And then I realized I might not be the smartest guy in the room right now.
I humbly disagree, man.
And I said, I think we should, capture this knowledge. So that is the inspiration for the Beyond the Tear podcast. And we're going to talk today about sort of if you're playing basketball or tennis or soccer long enough, at some point you tear your Achilles or someone who just did. Yeah. Your example is a good example of you just got off a filming thing and you're doing training. So the question I ask for you is, are Achilles rupture rates actually increasing? We're seeing them a lot in the news. We're seeing them in the NBA, random things in the NFL. Are they on the rise? Or are we just noticing them more? Are they getting more press? What do you think?
So I had that same question because I did mine June of 2025, maybe a week or two after Halliburton did his, which was like a week or two after Jason Tatum did his, which was a week or two after one of my friends did theirs, and then 2 weeks later after mine. So it felt like everyone we knew it was happening to. And so then that really begged the question, are these happening more, or are we just seeing it more often? And I did a little literature search, and it does appear that these are happening more frequently. The question is, are we just detecting them better? Like, is the actual amount of these tears happening more often? Or are we getting better at imaging or special tests that can help rule these in and they're getting diagnosed? But the authors of a lot of these studies, I think, say because we're participating in more recreational activities, especially middle-aged and older adults are becoming more active, which is a wonderful thing. It does come at the cost of a slight increase in the prevalence of Achilles tendon tears.
For the older population, I can say that the 65-year-old female that's a demographic that basically never had an Achilles tendon rupture. It just didn't happen.
Yeah.
Now it's probably on the biweekly that I'll have a 65-year-old female come in and they're fit. It's Los Angeles. It's a pickleball capital of the world, and it's a pickleball entry. Yeah. So I can say in that demographic, it's not even on the rise. It's an epidemic.
Yeah. Yeah. I mean, definitely classically, the classic characteristic is a 30 to 50-year-old male. Why? They're still young enough to try very aggressive athletics, but they're also old enough that they're not in their teens anymore. And there might have been some tendon degradation over time and all these things, or they just might not have been training the same way they used to. Weekend warrior, go back to it and pop. But definitely pickleball seems to be a pretty intense increase for the older population.
So let's talk about the mechanism of pickleball, the mechanism of basketball, Jason Tatum, Halliburton. What did you notice in how they did it that was consistent with a common injury? Like walk me through what you see as a doctor in physical therapy and your knowledge, because you did your thesis on this in your residency, correct?
Yeah, not a formal thesis, but lots of case presentations.
This is your baby.
This has become my baby from residency and now. And essentially what we know about these Achilles tendon tears is they happen from essentially overstretching it while trying to ballistically contract it. Right? They don't really happen when they're in their short ranged of position. It tends to be you're accelerating over a fixed foot. So that tendon is slowly getting stretched and you're trying to push off of it.
Over a fixed foot.
Yeah. So your foot is stuck to the ground. Your shin is coming forward. You're getting into what we call more dorsiflexion, but you're also trying to push off your toe. So you can think about starting sprinting, or in basketball, oftentimes, right? They're standing tall and they're trying to cut past someone. And that first step, their Achilles tendon is being stretched at the same time that they're trying to push off of it. This is why, it's almost never that an Achilles tendon injury is from landing. If it is, it's landing and then pushing off right after. Like for gymnasts, it'll be they land their round off and it's the punch after, or people landing when they jump downstairs and then immediately try to take a next step. It's not so much the landing, it's the take off because your foot is being stretched and you're pushing off of it.
Got it.
So one of the things we think about with pickleball and basketball is in order to be in that stance, you should do two things. One is bend at the waist, a hip hinge. And two is bend your knees. We think that when people don't bend at their waist, they're just bending at their knees. So they're super upright and tall. That calf is being very stretched. Instead of using the force from your hips, now you're putting way too much demand on the calf under a stretch load, and that's increasing the risk.
So you're saying that it's sort of the upright at the hip posture that is transmitting, providing need for the calf muscle at the knee level to do too much.
Yeah, that's one theory as to essentially it's the form, right? So, if you watch guys in basketball, they're boxing someone out. They're usually with their butt back, really kind of in a good hip hinge. They're not so tall, but when you see guys playing basketball and they're dribbling, they're a little bit more tall. And so when they take off Kobe or Steph Curry, Kevin Durant. And so usually it's as they're having the ball, they're trying to cut past someone. They're very tall. Their knee is very far forward. Pickleball, same thing, that pickleball stance. We don't see it as much in tennis because in tennis, I think the court is so big, it encourages good form to hinge at the hips, step back, make a circular arc versus a short, quick cutting maneuver in a very tall position. That's one theory. Another one is, especially with pro athletes, is Achilles tendonitis and calf strains do show a temporary rise in the risk. I think they say Achilles tendonitis is almost like a 4 times risk in the short term of rupture. But what do you think about that?
It's funny. So I did that in the Journal of Unpublished Medicine. You can like and subscribe. So this is a paper we did with Dr. Chris Sikowski back probably 15 years ago. And we looked at a Pearl Diver database, and we looked at fluoroquinolone use. That was the primary reason for its association. And then we looked at fluoroquinolone use with tendonitis, and then we looked at tendonitis preceding Achilles tendon rupture. And we reported on the data, and it was a small risk of about, call it 10%. So if you look, and that risk was for over the course of a year. So if you had the preceding diagnosis of Achilles tendinopathy, tendonitis, any of that category, there was a slight risk of that being a risk factor.
Yeah. Makes sense. I mean, obviously there's tons of people who get Achilles tendonitis and don't tear their Achilles or calf strains.
Yeah.
I think when it comes to that professional level, though, now you're seeing the NBA.
Yeah.
If somebody has a calf strain, they used to give him a week off. Now they give him a month off.
And so Kevin Durant had a preceding tendinopathy, and he had an MRI before he went back, and the MRI was normal.
Yeah.
So, these guys are hyper tested, and it's it's a challenging thing. Anywho, so when I presented that paper at the Academy meeting, which is our orthopedic specialty meeting, no one believed the data. And it got a lot of press. It got a press inside, and they're like, oh, it's doing it. And people stood up who I trusted. And I'm like, we don't believe you. And I'm like, don't shoot the messenger. I don't believe myself either.
They didn't believe that it was that low of an increase, or that
they did not believe it was a risk factor.
Oh, interesting.
Yeah. So it's sort of like, I don't know the answer to that question.
Yeah. There's, as far as my search, there's been some evidence that not just Achilles tendonitis, but calf strain and fluoroquinolone all have a slight increase in the rupture.
Yeah, so we did the fluoroquinolone, and I can tell you what I saw over 1 million cases in a database study, and what my practice is. Because anecdotally, it's not a black box warning. Fluoroquinolone use in tendon rupture and tendon. So we did see a little bit of tendinopathy increase with fluoroquinolone. We didn't see a rupture risk, but you could make that same sort of like slight risk, connect the dots kind of thing.
Like a jump, basically. Yeah.
Yeah. And I can say that, if I was on a fluoroquinolone, I would not be working out. I would be like, let me swim. I'm not going to tear my Achilles swimming. I'm not going to tear my cuff.
Nothing ballistic.
Nothing ballistic.
Yeah.
Well, there's not a lot of ballistic in my life anyways. like I don't have that problem. But quasi ballistic adjacent, if you will. But I did sort of back down that. As far as the reporting goes and the activity, people staying active, I do agree with you. What sports are you seeing in your practice where you're like, oh, those are the risky ones? Like those are the ones that you worry about?
Definitely anyone that does something cutting heavy. Basketball is a very famous one. Basketball, pickleball, soccer, tennis, maybe even in that order. Although basketball and pickleball might be flip-flop for who's number one.
Yeah.
Pickleball in the older community, basketball in the younger community, and then soccer and then tennis.
That's it.
Yeah.
That really is, those are Those are the ones. I mean,
I see a lot of stunt people just from word of mouth. A lot of times their story is actually, in my case, I was doing acrobatics, but a lot of times it's during a chase scene where they have to chase. I've heard plenty of people where they jump down a set of stairs to chase somebody, and then they take off for the next step. And it goes there.
Oh, that's interesting. Like they're filming like a cop and robber scene.
Exactly.
Yeah, that makes sense.
I've had gymnasts who they're doing a round off back tuck or a round off double back or whatever, and it's on the landing of the round off, they punch and they're trying to push off. I've heard a case, and I haven't seen this person, that during one of those gymnastic feats, they tore both of them at the same time, which is so horrible. Yeah, that's just a tough recovery. Again, heard of it, didn't see it, so who knows? But it really tends to be the cutting maneuvers. I'd be very surprised if it happens from bodybuilding type weightlifting, even if you're doing something heavy, because it's not ballistic in nature. It's really the quick, fast motions off a stretch leg.
Yeah, for sure. There's the element of, is there a social visibility? Is social media creating sort of this buzz? What do you think about that? Do you think that it's like everyone on their social is filming Achilles tendon ruptures, and we're seeing a lot of these because it's like, hey, I'm filming my form of this jump, or I'm filming this, what do you think about that?
Yeah, definitely cameras are everywhere now. So we're not only getting more footage, we're getting better angles of it. It seems like anytime a pro athlete happens, you can literally zoom in 4K and see the tendon pop.
Exactly.
I have mine on camera. It's not the angle where you can see it pop, but I think the other thing too is they are happening more often, and it might also just be that I've told people, I think as athletes keep getting better and better and better and better, one of the bottleneck features of our anatomy might be the Achilles tendon. We can get so much faster, we can get so much better at our form, but maybe the loads at our Achilles tendons can't grow as quickly as we want to get better. And I think the other thing too is people are really recognizing that this is a very tough injury to nail properly on the rehab and repair. I think even ACL tears are even managed better in the majority of cases, and it's a long one. So I think it really gets a lot of attention from the media, because when an athlete goes down, the first thing you hear is it's 1 year before it's going to be full recovery.
Well, we're going to save the recovery roadmap for the next podcast. This podcast, we're talking about, are they on the rise? I think we could probably conclude safely. I think they are. I think there's a visibility issue, there's a presence issue, but we would agree that they are on the rise. Hopefully you're listening to the podcast for interest enough for your own personal discovery. And if you are, keep along with the rehab. We're going to be talking on future podcasts about the rehabilitation, about some of the reasons why we do what we do. So you can get back on the court, and that's really all we're trying to get to there. For Dr. Timothy Charlton, for Dr. Shayan Safar, this is Beyond the Tear, and we're out.
Rogue. Unity Physical Therapy.